So we are discussing the antitussives. We have already discussed the opioid antitussives, non-opioid antitussives. Today we will discuss the antihistaminics. So antihistamines also given for the cough, and it is usually given whenever there is allergy or whenever there is running nose, sinusitis is there associated with the symptoms of upper respiratory tract. There we can prescribe the antihistaminics. So this how this drug works. First, let's understand how the cough occurs. Whenever there is, for example, this is the dust particle or say any allergen. Suppose this is the allergen which is not required by the body. Suppose this allergen try to enter our respiratory passages. As this allergen tries to go inside the respiratory passages, so what happens, our defense mechanism activated. Suppose this is the bronchus I am drying, and this is the bronchus, and these are our two lungs. What happens whenever this allergen or any dust particle or any foreign materials try to enters the our respiratory passages, so our respiratory passage does not want this foreign material to enter, so there are certain defense which is gets activated, and this defense activation occurs because there is release of histamines, and this causes the bronchus to undergo bronchial constriction. So first happens what the bronchus undergo small narrow in size to limit the entry. It will limit the entry. It will limit the entry of this foreign material or allergen inside our respiratory passages, and this is the defense mechanism by bronchoconstriction. Bronchoconstriction. And also when it will enter, there is also in the respiratory passages we have these cells I am drawing here. These are the goblet cells that produce lot of mucus. It produces mucus, and here lot of mucus is being produced, and I am showing here this is mucus. This is the mucus, and we know that mucus is very much sticky, and it will bind with these allergen or any dust particle or any foreign particle being binded by being attached by the mucus, and it will not allow this dust particle to go further down the respiratory passages to reach the lungs. So this dust particle is also being limited by this production of mucus, and it is also the defense mechanism. So first defense was the bronchoconstriction, then there is production of mucus to limit the entry of this allergen or any dust particle inside our lungs. And as we know, there is bronchoconstriction and there is mucus production. So what happens, suppose I'm drawing here, this is the bronchus and it undergoing bronchial constriction, and there is a lot of secretion get collected. So this will lead to the activation of the receptors which are present in the respiratory passage. These are called the stretch receptors. Stretch receptors, they are activated by the secretions, by the bronchospasm, bronchoconstriction, and mucus will activate these stretch receptors. They will activate it, and what these stretch receptors do, these stretch receptors then send the signal to our central nervous system. Here is the central nervous system. Here is the cuff center located in the medulla oblongata. Medulla. Here is the cuff center. Cuff center. So what happens, this signals goes to the brain in the central nervous system in the medulla oblongata. The cuff center get activated, and it then produces certain excitatory impulses that goes down into the vocal cord, larynx, pharynx, abdominal muscle, and even diaphragm. And these muscles of this vocal cord, larynx, pharynx, they get activated and work in a coordinated way to initiate the cough reflux. Cough reflux initiated, and the patient tried to cough. It's also the defense mechanism, and as the patient cough, this dust particle which was and trying to enter, it will be thrown out. It will be thrown out. So this was again the defense mechanism which occurs to limit the entry of allergen or foreign particle outside the body. So this was how this body tries to prevent the entry. So now I will tell the at a very molecular level how this is happening, how the bronchoconstriction occurring at a molecular level. Suppose this is the bronchus, and in the bronchus we have these smooth muscles, respiratory smooth muscles. These are the respiratory smooth muscles. And also in the bronchus, I will draw here certain glands, or these are the goblet cells are there. These produce the mucus. So I will zoom this out later. There are certain receptors also. There are receptors on the goblet cell and on the respiratory smooth muscle. This is the respiratory smooth muscle, and these are the goblet cell which produce the mucus. So what happens, these are the receptors I am drawing here, the histamine. These receptors are for histamines. These are H1 histamine receptors, and some are muscarinic also, muscarinic M3 receptors. So they are present on the respiratory smooth muscle and goblet cells. So what happens, I will zoom it out. Suppose this was the cell here, this is the respiratory smooth muscle cell, here the H1, this is the H1 receptor, the histamine. Now suppose this is the histamine molecule. Whenever the allergen enters the respiratory passages, what happens, there is production of lot of histamines. So what this histamine will do, histamine try to bind with the receptors present on the respiratory smooth muscles, and as a result, there occurs the activation of these Respiratory smooth muscle, they undergo the signal transduction. Here I am not going to detail here what type of signal transduction is taking place. So you just remember, whenever the histamine bind with the histamine receptors, there occurs the opening of the calcium channels. As a result, lot of calcium enters the respiratory smooth muscle, and these respiratory smooth muscles get activated, and it undergo depolarization, and they start contracting. They become smaller in size, and as a result of which, whenever the smooth muscle contract, the bronchus becomes smaller, and this is how the bronchoconstriction take place as a result of binding of histamine with the histamine receptors on the bronchial smooth muscle. Also, suppose this was the goblet cell, this is the large goblet cell, there is the histamine also bind with these receptors of the goblet cell, and the goblet cell produce lot of mucus as a result of activation by the histamine. This is histamine binding with the histamine receptor. So this mucus is also being produced as a result of binding of acetylcholine with the M3 receptor. So when we give antihistamines to the patient, antihistamines, what it will do, antihistamines will block the binding of histamine with the histamine receptors here and here also. So what happens, the bronchoconstriction will not take place, and also the mucus production will decrease. I would like to tell here that certain antihistamines also block the M3 receptors, so further mucus production will go down. So bronchoconstriction will not take place and mucus production will reduce, and as a result, as we know, whenever there is no more irritation or no more bronchospasm, no more secretions are there, so there is no more impulses that are being generated, and these impulses will not reach to the central nervous system to cause the cough. So the patient will be relieved from cough. Also, histamines also work in our central nervous system. So histamine has the receptors on the central nervous system. So whenever the histamine enters the central nervous system, so there are receptors which are scattered throughout the central nervous system for histamines. These are called the H1 type of receptors, most predominantly present in the central nervous system. And also the acetylcholine receptors are also present in the central nervous system, which are the muscarinic M3 type of receptors. These are the muscarinic receptors for the acetylcholine, muscarinic receptors. And also certain other receptors for serotonin receptors are also there, which are the serotonergic receptor. They are also present in the central nervous system. So whenever the histamines, especially the histamines which enter the central nervous systems, what it does, it activates the central nervous system by producing the excitatory impulses are being generated by the activation of the histaminic receptors and the muscarinic receptors and the serotonergic receptors. They send the excitatory impulses throughout the central nervous system, and this mechanism will keep the patient awake, and this awakeness is because of the activation of these receptors by the histamines and the muscarinic receptors and the serotonergic receptors. So what does the antihistamines do? Antihistamines, especially the antihistamines, are those which are the first generation. So first generation antihistamines, especially the drugs like chlorpheniramine, promethazine, these are the first generation antihistamines, promethazine, and even diphenhydramine. These are fat soluble, and they easily cross the blood brain barrier and enter the central nervous system and block these histaminic receptors. In addition to blockage of these histaminic receptors, they also block the muscarinic receptor and serotonergic receptors, as a result of which these excitatory impulses which are generated, they are no more generated, and the patient will remain no more awake, and the patient becomes sedated. So these antihistaminics, especially the first generation antihistaminics, produce sedation, and this sedation also calms the patient from undue sensations of cough, and in this way they also relieve the patient from cough stimulus. And you should be remembering here, since they also block the muscarinic receptors, these antihistaminics produces the side effect like it produce the dryness of almost most secretions of the body, and patient can have dry mouth because of blockages of the muscarinic receptors on various tissues of the body. And now these are the drugs for the dose. These are the first generation antihistaminics which are used to given for cough. Here I can see the chlorpheniramine tablet. The usual dose of chlorpheniramine is 2 to 5 mg. Here I can see it comes in the form of tablet, as well as comes in the form of syrup. And these are the chlorpheniramine tablets which are prescribed for, as we can see, it will relieve the patient from sneezing, running nose, itchy and watery eyes, since they dry up the secretions, and they are also given for itchy throat. Here is the 4 mg chlorpheniramine malate tablets. And it also used as a combination with dextromethorphan. Here I can see each 5 ml of the syrup contains 10 mg of dextromethorphan and 2 mg of chlorpheniramine. So it has a slightly 2 to 5 mg of dose of chlorpheniramine. You have to remember it. Then one more drug is also the first generation antihistamine is the promethazine, also known as the Finargan. Here we can see the syrup of Finargan, where 5 ml of Finargan contains 5 mg of promethazine. And also one more drug is the diphenhydramine. Here we can see the diphenhydramine 25 mg capsules are there. They relieve the patient from coughing, sneezing, running nose and sore throat. So this was about the antihistamines which acts to relieve the cough.